And we're live on YouTube po. Good morning to all our media partners, CHD, and everyone who is watching on YouTube. We are also joined by students from PUP. I am Jolo from the DOH Communications Management Unit. And in our kapihan today, we'll have a discussion about COVID-19 case trends and some biosurveillance update. So here with us today is Dr. Althea de Guzman from the DOH Epidemiology Bureau. Good morning po, Dr.
Good morning, Jolo.
Also have Dr. Eva Cutionco de la Paz. She is currently the Executive Director of the National Institutes of Health, UPM, and the Director for the Health Program of the Philippine Genome Center. Good morning po, Dr. Eva.
Magandang umaga, Jolo, at magandang umaga po sa lahat ng ating kasama rito sa kapihan ng DOH.
So for the first presentation, let's have Dr. Thea na po. Thea.
Salamat, Jolo. For sharing my screen. So, again, good morning po to everyone with us here, both our media partners and their students. We'd like to be able to provide you an update on kamusta na po ba ang ating sitwasyon sa COVID, lalo na po base sa datos itong nakaraang linggo. So, I'd like to start off with 4 key messages. For number 1, we saw that nationally, the overall case risk classification is actually maintained at low risk po. No? At nakikita natin ang ating ADAR or ang ating average daily attack rate ay tuloy-tuloy pong bumababa nitong nakaraan 2 linggo. Subalit, meron tayong mga rehiyon na hindi na-sustain ang negative na 2-week growth rate at ngayon ay nagpapakita na po ng positive na 2-week growth rate or ibig sabihin na tumataas po yung dami ng mga nare-report na kaso. At ito ang Regions 1, Mimaropa, and the Cordillera Administrative Region po. Nakakita din tayo ng tinatawag nating trend reversal sa 7 NCR areas kung saan mula sa negative na 2-week growth rate tayo ngayon ay may positive 2-week growth rate sa 7 NCR cities. Nagkaroon naman din po ng improvement sa mga utilization rates ng ating healthcare and ICU beds in most of the areas we flagged in the recent 2 weeks. Subalit, meron pa rin mga rehiyon na na-maintain ang kanilang high to critical risk utilization in the past week. And lastly, at ito ay dadagdagan ni Dr. Eva mamaya, wala pa tayong nare-report sa ngayon na Delta variant of concern locally. Ito ay naiiwan lamang sa mga na-positibo among our incoming international travelers. Kaya naman higit na mahalaga ang pagpapabilis ng malakas na public health system and capacity as well as our vaccination. Doon nga sa tinatawag natin, it's a race against the variants. We need to get several steps ahead of them. This was the data we presented yesterday, and what we'd like to emphasize is the further decrease in the proportion of cases who remain active. So I always try to point out that from a high of 12%, it's only now around 30.3%. Ikalawa din po ay naiwan na ang ating cumulative case fatality rate ay at 1.7%. Mababa kumpara doon sa mga naunang CFRs natin even last year na umabot na tayo ng 2%. Pagdating naman sa mga regions at areas na mayroong pinakamadaming nare-report na kaso, nakikita natin sa ating region na una, naiiwan po yung mga pinakamalaking regions natin, ang NCR 4A at Region 3, subalit nadadagdag ang 2 rehiyon na mas maliit tulad ng Region 1 and Region 6. I'd like to show you the testing data because there's a lot of question whether tayo ba kumukonti ang kaso dahil masyadong bumababa ang dami ng natitest natin. Makikita natin dito na while there were less number of cases being tested, once we started also to see a decline in cases around May, naiwan na po siya, halos nagpa-plateau, and the decreases are already very small. So for example, there was only a 3.8% decrease over the last week compared to previous week, or we're now averaging around almost 49,000 tests, no, over the past week. Pero nakikita natin, ito po yung represented naman ng red line, na yung pagbaba ng dami ng mga positive individuals ay mas mabilis, no? Higit na mababa ang linyang ito kumpara sa binaba, no, ng ating testing output. And our national positivity rate is at 10.8 versus the 11.1 we reported the week prior. In our epidemic curve, napakita ko dati, no, over the first 2 weeks of June, the number of cases getting ill were higher than the 7-day moving average. And this was because of the case increases we saw in the Visayas and Mindanao areas. So balit pagkatapos, no, mula ng mid-June, nakita natin itong mga bars na to ay bumababa na at nasa ilalim na po siya ng ating 7-day moving average. Nakikita din natin na yung mga black bars representing the regions outside NCR, 3, 4A, 6, and 7 are still the ones contributing most to our new cases getting ill. We also saw some improvement po, no, in our average cases per day, which is now at 5,221 nationally versus the 5,458. Over, I think, the first week, the second week of June, parang plateau po siya kung mapapansin niyo po itong linyang ito. Pero yung pagbaba, no, sa dami ng mga nare-report na kaso natin nationally ay mas naging evident nung dulo po ng Hunyo at nagpapatuloy po hanggang ngayon po in July. Kaya lamang po kung ihihiwa-hiwalay natin sila per island group, ang mga mapapansin natin ay una, yung dalawang pinakamababang linya, ang NCR plus areas, ay plateau na, no? Parang magkapatong, halos pareho na po ang mga nare-report sa plus areas at sa NCR area natin. Nakita din natin after Visayas and Mindanao peak around middle of June, ito po yung mga orange lines at ito po yung aqua blue line below. Ngayon po ay nagpapakita na po ng pagbaba ng kaso. Subalit, ito pong red line representing the rest of Luzon ay ngayon ay may bahagyang pagdami ng mga nare-report na kaso at ipakikita ko later saan nanggagaling, no, itong increases na ito. This is our latest 2-week growth rate in Nadar where we showed a negative 10%, no, na 2-week growth rate. Almost the same as the negative 9 2-week growth rate we saw 3 to 4 weeks ago. Our average daily attack rate also slightly decreased from 5.42 to 4.88 and thus the low risk classification in terms of our case data. However, we have 3 regions whose risk classification is at high risk and these are regions 11, 6, and CAR. At nakita nga natin na from negative 8 para sa CAR, ngayon po ay tumaas siya by 10%. Ang dalawang rehiyon pa na tinatawag nating nag-trend reversal are regions 1 and Mimaropa were from negative 2-week growth rates. Ngayon po ay naging positive na po ang 2-week growth rate. Ang mga binabantayan din natin, hindi lamang dahil sa pagtaas ng kaso, subalit because of their utilization rates are 11, 6, and CAR. Kung mapakikita nyo, sila yung naiiwan na ang ICU rates ay from moderate to as high as critical risk para sa Region 6. Ganon din para sa mga Regions 12 at 5 na meron pong high risk ICU utilization. We now have 19 priority areas. So this is lower than what we reported probably 2 to 3 weeks ago, reaching as high as 30. So balit ito po yung nababanggit ko na datapwat nabawasan na po yung ating mga flag areas. Meron po tayo mga nakabox dito na mga lugar kung saan naiiwan na mataas pa, from high to critical risk pa ang either the ICU rate or the H per. No? So we have Cagayan, Bataan, Naga City, Iloilo City, and Bohol, Tacloban City, CDO, Davao City, Davao del Norte, Jensan, South Cotabato, and areas in CAR such as Apayao and Baguio City. Now, tingnan natin ang NCR. Kung magsisimula ako sa pag-show na ang ating average cases is already at 633, slightly lower, no, than the 644 we saw last week. Kaya naman, kung mapapansin nyo, mula sa dulo ng Hunyo hanggang ngayong pong July, flat, no? Plateau po talaga ang ating NCR area at very, very slow po yung pag-decline. At ito nga po yung nabanggit natin na meron tayong 7 areas na ngayon ay nagpakita na ng positive 2-week growth rate. And these are the cities of Makati, San Juan, Muntinlupa, Mandaluyong, Manila, Malabon, and Navotas. No? At meron tayong 2 lugar na naiiwan pa na high-risk classification, and these are Makati and San Juan. At sila din po yung nagpapakita ng high to critical risk either H curve, which is for Makati, or a critical risk ICU utilization po for San Juan. Sorry, pasensya na po, these are relatively small. Pero what we want to point out here is that the positive 2-week growth rate is also observed, no? Doon po sa mga epidemic curves ng mga lugar na to at idadagdag po namin ang Las Piñas. Anong ibig sabihin? Ito pong linyan to na nakikita nyo sa bawat epidemic curve, binabantayan natin kung ang mga bars sa ilalim niya ay lumalagpas na dito sa line na to. At sa 8 areas na to, nakita natin na nitong nakaraan 2 linggo, ang mga kaso na nagkakasakit ay lumalagpas na po dun sa ating 7-day moving average po. Hindi pa po nare-reflect ng malaki sa ating ICU utilization at H curve ang nakikita nating pagtaas ng mga kaso sa iilang NCR areas. Ito ay panahon para ang mga hospitals natin ay higit pang bantayan ang kanilang admissions para ma-ensure natin na naiiwan tayo, no, na safe zone ng ating ICU utilization rates at H curve. Pero ito po yung babantayan natin na kikita natin ang mga pending admission sa ating ER ay unti-unti na pong tumataas, no? So, posibleng ito ay nagre-reflect na nga po ng pagtaas ng kaso na nakikita natin. And again, this is the opportunity for our LGUs and our hospitals to start shoring up their ward beds, ICU beds, so that in case this increase continues, hindi po tayo ma-overwhelm, no? Hindi tayo aabot ulit to high to critical risk utilization rates. Para naman sa ating plus areas, lahat ng plus areas liban sa Laguna ay nagpakita ng pababa ng kaso tapos nasundan po ng flattening, no? Ito po ang Cavite, the brown line, Rizal, which is the yellow-green line, and the aqua-blue line is Rizal po pala. At ito pong yellow-green line is Bulacan. So balit, para po sa Laguna, imbis na pagbaba, nakakita pa po tayo ng pagtaas ng ng kaso niya nung dulo po ng Hunyo, na ngayon na lamang po tayo nakakita ng bahagyang pagbaba ng kanyang kaso. Overall, in the last 2 weeks, the 2-week growth rates are negative. Laguna remains to have a high-risk radar, and the only area in the plus areas where the ICU rate is not yet at safe zone or at low risk. Now, quickly lamang po para sa Luzon, gusto ko lang pong i-point out itong blue line na mabilis ang pagtaas, at ito po ang Region 1. No? May bahagyaring pagtaas ng kaso tayong nakita para po sa CAR, which is the green line, though it's a slower increase in cases. The rest of the areas in Luzon have actually already declined. At para po sa Region 1, halos lahat ng areas po ay mabilis na tumaas ang kaso nitong dulo po ng Hunyo, iban po sa Dagupan City. At sa ngayon, may 3 areas, La Union, Ilocos Norte at Ilocos Sur, na naka-high risk classification. Subalit hindi pa tayo kakakita ng healthcare or ICU utilization rates na umabot po ng high risk or critical risk. At ito po ay reflection, no, nung sapat na dami ng mga kama para po sa ating hospital at para sa ating mga ICU. Sa Visayas naman po, overall, ito pong Region 6, after it peaked in the middle of June, it went down, kaya lamang po ngayon ay pataas na po. Ang Region 7 naman po, which is the orange line, is also showing some more erratic, inconsistent trend. Subalit may bahagyang pagtaas itong nakaraang linggo. Ang Region 8 lamang po ang nakakita tayo ng tuloy-tuloy na pagbaba ng kaso simula po ng Hulyo. At para po sa Region 6, kailangan po namin i-flag ang apat na lugar, both Iloilo Province and City, Aklan, and kung saan nakakita tayo ng pagtaas, no, yung mas mabilis na pagdami ng mga nare-report na kaso natin. At ngayon nga po, nare-reflect sa ating 2-week growth rate ang tatlong lugar na naka-high risk classification. And these are the cities and province of Iloilo as well as Aklan. At tayo ay nakakita din ng ng critical risk healthcare utilization para sa parehong probinsya at syudad ng Iloilo, and the critical risk ICU utilization rate for Iloilo City as well as Antique po. Now, para naman po sa Region 7, ang Negros Oriental ay nagpapakita ng pagbaba ng kaso. Subalit ang ibang mga lugar tulad ng Bohol, Cebu City, Cebu Province, which is the green line here, as well as Lapu-Lapu City, ay is showing the increasing trend in their cases starting July po. And this is reflected by their 2-week growth rate. So, si Bohol at Negros Oriental, sila po yung may pinakamataas na kaso nitong nakaraang buwan. Subalit pababa na nga po. But the other areas in Region 7 are now showing positive 2-week growth rates to as high as 81% for Lapu-Lapu City. For Bohol and Negros, though the cases have already started to decline, we're also monitoring their age curve and ICU rates kasi naiiwan pa po sila sa high risk. For Mindanao, gusto ko lang pong ipakita na ang kanilang case trend ay pababa na po. No? So for Davao, this orange line, after a decline, ngayon po may konting pagtaas. Kaya po, closely monitored pa rin po ang ating Mindanao areas. And for our mortality, the average cases per day have continued to decline. And siguro gusto ko lang pong i-konteksto ang ating mortality data. Oo, pagdating po sa bilang, madami po talaga, no? But it follows that with increasing cases, there will be increasing deaths. Pero kung mapapansin nyo, ang ating case fatality rate was actually lower this year compared to last year when we had less cases. In the next kapihan siguro, we'll show you further analysis of that, and it may be reflective of our improved healthcare capacity as well as improved clinical care management. The last that I'd like to show is an analysis of our age groups. We were asked, did we see any particular increases in our cases and deaths in terms of our age groups? At ito po yung nakita natin. Ito po ay hinati natin sa apat na age group. We have the less than 5, the 5 to 17, which are the pediatric age groups, the 18 to 59, and the elderly po. Makita natin na sa pagtaas ng kaso natin overall, ganun din po, no? Lahat din ng age groups natin sumabay ang pagtaas. Wala po tayong nakitang age group na parang umoverlap, no? Or nag-overtake sa ibang age group. Naiiwan po na pare-pareho ang trend po nila. At naka-reflect po yun dun sa ano ba yung ambag ng bawat age group dun sa total cases. So kinukumpara natin nung panahon bago po tayo magsimula na mag-case spike hanggang ngayon po, ang obserbasyon natin yung pagbabago ng contribution, no, ng bawat age group sa total cases ay hindi po talaga masyadong hindi siya significantly na nag-change. No? There might be some increases such as the 60 years old and above from 13.7, it increased by 1.3% to 15% in June to July. Pero kung titingnan natin, hindi po napaka-significant ng mga pagbabago ng contribution natin. Subalit, ang nakita po namin, pagdating po sa deaths, no? How much is each age group contributing to the total deaths? This is what we saw. On January 31 to February 6, our elderly were contributing to as high as 71% of all our deaths. By June 27 to July 3, they're still contributing to majority of our deaths. but this is lower at 63.2%. No? So ito ay pinag-aaralan pa natin. Bakit kaya? No? Though madami pa rin ang deaths natin among the elderly, but kung ilalatag ko, it's only now contributing 63% versus the 71% at the start of the year. We may see number one, is it because they're less mobile and as such, less prone to infection? Or is it because we've already begun? No? This was the time we started the vaccination for our A2. No? So wala pa tayong very definitive conclusion. This is initial data that we saw, but we're going to further study this so that we can see, no? Ito yung madalas na tanong nyo, ano na po bang epekto ng ating pagbabakuna and how much has this protected, especially our A1, A2, and A3 population. I'd just like to end with this, no? And Dr. Eva can further elaborate on this. Gusto lang namin i-emphasize yung halaga ng bawat course po natin sa further strategy. Pero ngayon, as we want to further prevent, delay entry, and win this race against COVID-19 and its variants, napakahalaga ng pagpapalakas natin sa door 2, which is our border control, so that tayo ay naghahanda. No? Alam mo, we're really delaying. It's really, potentially papasok talaga to mga Delta, Gamma, and ibang variants of concern. Pero bago po yan pumasok, gusto natin sapat na, malakas na yung ating sistema at nakahanda tayo sa mga nilista kong scenario dito. Paano gagawin? So may plano kung makakita na talaga tayo ng isang Delta variant locally. May plano kung nakakakita na tayo ng pagtaas ng kaso o di kaya napakabilis, no, na pagdami ng kaso at pagkalat ng infection, o yung pinakadulo, yung door 4 natin, overwhelmed, no? Puno again ang ating admissions, ang ating ICU. Ito ang mga senaryo na pinaghahandaan natin habang tayo ay wala pang nadedetect na mga Delta or other new VOCs locally. So, yun lamang, Shola. Thank you. I'll turn it over now to Dr. Rael.
Thank you, Dr. Thea, for the updates on the COVID-19 national situation. So now to give us updates, now to give us biosurveillance updates is Dr. Eva. Dr. Eva.
Magandang araw po muli sa inyong lahat. Ako po ang magbabahagi ng updates tungkol sa variants mula sa ating IATF-TWG on variants. Of course, kasama po natin dito ang Department of Health Epidemiology Bureau. In this graphic presentation, the WHO shows all the countries, territories, and areas reporting variants of concern. We all know now as Alpha, Beta, Gamma, and Delta as of July 6, 2021. We can see how the different variants of concerns have spread worldwide. The colors do not necessarily show us the actual numbers. It just shows the representation of the countries having the presence of each of these variants of concern. In the Philippines to date, out of the 7,878 that we have sequenced so far through our national genomic surveillance, the Beta variant accounts for 1,386 cases, and Alpha 1,217 cases. Gamma has remained at 2 cases detected, and Delta variant at 19. And these 19 cases are all from incoming international travelers. There are no local cases reported so far. The theta here, which is the P.3, first detected in the Philippines, remains at a low number of 166. So this is not a variant of concern, it's a variant of interest as of a few days ago, but let me explain why I'm saying that. So due to the ongoing high rates of transmission around the world, all variants are expected to continue to evolve over time. It has been repeatedly observed over the course of the pandemic that variants do acquire same or similar amino acid substitutions. If you remember, yung mga N501, E484K, these are types of mutations that are seen in many of the variants of concern as well as variants of interest. And they may, because the virus acquires these mutations because they offer a competitive advantage. Likewise, the understanding of the impact of these variants are expected to evolve, and information updates reflect these as new evidence becomes available. Now, because of this, the WHO periodically reviews and adjusts its working definitions. On this slide are the revised set of definitions for variants of concern, a SARS-CoV-2 variant that meets the definition of DOI, and these are seen in these three. I'm sure you all are familiar with this already. And this is, it is designated as a variant of concern through a comparative assessment that has been demonstrated to be associated with one or more of the following changes of global public health significance. In contrast, if we talk about variants of interest, they define it as those with genetic changes that are predicted or known to affect virus characteristics, just like what we have in the variants of concern. But notably, it is important to note that in the definition, it says identified to cause significant community transmission or multiple COVID-19 clusters in multiple countries with increasing relative prevalence alongside increasing number of cases over time, and may suggest an emerging risk to global public health. Now, in addition to the variants of concern and variants of interest, a third category labeled alerts for further monitoring has been put forth. This includes variants with indications that they may pose a risk to global public health depending on the evolving pandemic, but for which evidence of phenotypic or epidemiological impacts are less clear when compared to the listed variants of concerns and variants of interest. A previously designated variant of interest or variant of concern, which has conclusively demonstrated to no longer pose a major added risk to global public health compared to other circulating SARS-CoV-2 variants, can be reclassified. So this is a very important addition to the classification. Now this slide shows us the WHO currently designated variants of concern, which includes alpha, beta, gamma, as well as delta. Now, we have heard also in the last few weeks about variants of concerns plus, like the Delta variant plus. These are variants of concern with additional amino acid changes. They comprise a small fraction of the total number of sequence cases. There is also still limited direct evidence of further phenotypic impacts. So they're not really put in the category of variants of concern, not yet. Now, let me show you, because I showed this 2 weeks ago, but the table of the WHO currently designated as variants of interest has shortened. The list has been shortened, and it's now only Eta, Iota, Kappa, and Lambda. Lambda has been a concern recently because of something in the news about this variant, but at the moment, it is still just a variant of interest. This was first detected in Peru. As I will emphasize it again, Lambda is just still categorized as a variant of interest. But I'd like you to take note that Theta, or P.3, the variant of interest first identified in the Philippines and we reported in March, has been taken out of the list and now reclassified as alerts, as a variant, as a variant that is classified under alerts for further monitoring. Now, this slide shows 8 of the 12 in this category, including the P.3 here, which was first detected in the Philippines, designated as a variant of concern by March 24, but it is now reclassified as of July 6 as an alert for further monitoring. The WHO emphasized that the assessment considers primarily global risks posed by variants, and national authorities may choose to continue to designate this as variants of local interest or local concern. Just to for us to remember about Theta, which P.3, which was designated as Theta, it carries mutations with suspected or established phenotypic impacts. It harbors several amino acids changes suggestive of increased resistance to neutralizing antibodies and is potentially more transmissible. However, as I mentioned previously, it has been reclassified by the WHO as alerts for further monitoring, along with Epsilon and Zeta, the P.2. And the reason for this is its reported detection has decreased over time. A total of 269 sequences were uploaded to GSAID from 14 countries, not only from the Philippines, as of July 6th. And 71%, majority of the sequences were reported in the Philippines, mostly in Central Visayas region. There have only been sporadic detections or small clusters of cases that have been reported globally, justifying its classification. Now, this is a busy slide or busy table. It shows the performance of the vaccines against variants of concern. I will not talk about this in detail, but you can always go to the COVID-19 Weekly Epidemiological Update, edition 47, the latest one. But I just wanted to illustrate that the vaccines evaluated may have differences in effectiveness against disease or infection, but they remain effective, especially in preventing severe disease and death. So the key messages in this part of the presentation are as follows. The P.3 has been reclassified by the WHO under the category of alert for further monitoring. There are no local cases of Delta variant to date, but we still need to remain vigilant and practice minimum public health standards. I think this was emphasized by Dr. Thea. And lastly, vaccines work against the virus. It prevents severe disease and death. Thank you very much for your attention.
Thank you, Doc Eva, for your presentation. So from the presentation from Doc Thea and Doc Eva, we can see that, yes, we are really in a race against the variants. Kaya sinabi ni Sec Duque kagabi. We can observe that our neighbors are experiencing a sharp surge due to the spread of the more transmissible variants. And our stricter health interventions, such as the NCR plus wide lockdowns and strict border control measures, have given us a head start. But we have to use this head start wisely to actually vaccinate more A2, yung mga senior citizens natin, since sila yung mga nasa high-risk group natin and at risk for severe COVID-19 and deaths kung di sila nabakunahan. Also have to strengthen the implementation of the PDR-TR strategies and closely monitor the flagged areas so we can be ready to respond immediately kapag nangailangan. Sabi nga ni Doc Eva at ni Doc Thea, yes, we really have to remain vigilant and huwag tayo maging complacent sa pagsunod sa ating minimum public health standards. Since our situation really is constantly changing, we may have low cases today pero bukas baka biglang mag-surge. So We have to be alert always. So for the open forum, let's move on to the open forum. For the open forum, let's have Red Mendoza first. Red.
Hi, good morning. Good morning, Doc Eva. Good morning, Doc Thea. Doc Thea, first question. Kasi you said nga na it's a race against time and hindi natin pipigilan yung Delta variant na pumasok dito sa ating country. Pero do you think the DOH is being sabihin na natin, let's be upfront of what is defeatist in this attitude kasi people are clamoring for additional border restrictions. Yung mga ibang mga experts are saying, dapat mag-border control tayo. Huwag tayo magpapasok ng kahit na sino. As Yusek Vergere had said, hindi nga it's impossible right now. Pero yun pa rin eh. The people will say na dapat nagkaroon tayo ng border control. Dapat magkaroon pa rin tayo ng border control. Dapat hindi pa rin tayo magpapasok ng kahit na sino na na 90 countries para hindi tayo magkaroon ng explosion of cases like Indonesia right now and yun nga sa UK and US. What can you say about this? I mean, once and for all, do we think na border controls work? Do we think that we need to shut down our country against all of other countries? Kasi that is one main contention na kinikritisa sa DOH kasi pag nag late tayo ng border control baka sabihin nila ay late tayo ng border control kaya nagkaroon ng surge and all that shiz yung ganon.
Ed, salamat, no? Siguro, I wouldn't call it a defeatist attitude. It's really being realistic. We're 1 year into this pandemic and I really feel na sa isang taon naman yun, marami na tayong natutunan. At una, ang ating travel ban, no, ay door 1 lamang yon. That's an initial way to control the entry of people into the country. But that's not really sustainable. Not just because of economic concerns, but we have a lot of Filipinos outside who really need to go back already. And that's why, habang ang ginawa natin, nag-travel ban tayo. Pero alam nyo, ang travel ban para sa akin, para lamang yung community quarantine. It's there to buy us time so that the second door, which is door 2, will be stronger. We've seen the border control to be stronger. No? And I think one evidence of that is in the past few months, number 1, we haven't detected any local case of P.1. We have yet to detect that Delta variant, no, within the country. I'm not saying it's going to stay that way forever. It's really potentially going to enter. Pero yun nga, itong door 2 na to, ang pumipigil, no, nagbibigay sa atin ng oras para kung makapasok man talaga siya, may paghahanda na tayong ginagawa dito. Madami tayong natutunan last year. Sa tingin ko, higit pa tayong madaming natutunan ngayong taon na to, lalo na nung nag-spike tayo na una, yung biosurveillance natin ay andyan para magbigay ng impormasyon kung ano ba yung threat, kung may presence ba of any of these variants of concern locally. Pero kasabay doon ay yung strong surveillance systems natin. Kaya pansin nyo, dagdag lamang ang WGS natin. The core is the surveillance which monitors kung meron na tayong spikes sa baba. No? Para hindi pa natin alam kung meron ng Delta dyan or anumang VOC, meron na tayong ginagawa. So yun yung halaga ng ini-implement natin na 4-door strategy. Each has its role to play and each will have to be strengthened. At parang may panahon na gagamitin natin yung bawat doors sa strategy na yun.
Okay, Dr. Ya. Last question, of course, kasi two questions lang tayo right now. Then to Adam. To Doc Eva. Doc, we saw nga yung current na statistics natin ng mga variants na na-sequence natin out of the more than 7,000, almost 8,000 na na-sequence natin. 1,386 beta variant, 1,217 alpha. Doc, kamusta na po yung ating yung sampling natin for the variants? Can we say na is beta the quote-unquote dominant variant in the country? And and if hindi man po, how can we ever determine kung anin pong variant ang sinasabi nating dominant, quote-unquote dominant in the country? Kasi hanggang ngayon, wala pa rin tayong ma-detect kung alin ba yung variant na pinaka-dominant dito sa atin, Doc.
Thank you, Doc. Mr. Red Mendoza. You always ask very important questions. Well, the first thing is when you talk about dominant, which means probably we should have sequenced enough to be able to say it's the dominant variant. If you look at our sequencing, we have mentioned this also a couple of times already, that we are only able to sequence 1% of our RT-PCR positive cases. And because we also need to realize that we have limited resources and not able to do as much sequencing as we would like to. However, we have employed a strategy such that we do purposive sampling, and we focus on areas with surge, no, or may mga cases na parang nakikita na clustering of cases, so that our data becomes important for informing policies. So sa ngayon, itong sinasabi nating na pinakamarami nating na sequence ay yung beta variant. It only shows the proportion of the variants that we have sequenced so far. So mahirap kasing mag-make ng conclusion ng dominant. Perhaps what we can say is it's the most number or the majority of cases that we have sequenced so far. So it's always in proportion to the number of samples we have sequenced. Hopefully, over the course of time, we now have, thanks to the Department of Health, we now have all the reagents we need to be able to sequence more regularly in the next weeks to come. We should be able to sequence the 750 samples we have committed every week, but we can increase that should we find areas where there will be a surge in cases. So meron po tayong mga backup plans for supporting more samples to be sequenced in the next few weeks to months, depending on the situation that we see on the ground, Mr. Mendoza. I hope I have answered your question.
Okay po. Salamat po. Salamat po, Doc Eva. Salamat, Doc Tea. Salamat, Cholo.
Thank you, Red. For the next question, let's have Kat.
Good morning. My questions are for Dr. Althea. Ma'am, first po, Aklan is classified as high risk as well as Bohol and Iloilo. Is it accurate to say po na tourist spots are primary contributors to the rise in cases?
Sa tingin ko hindi, no? Mahirap natin i-conclude na kesyo tourist spot ka, ikaw na talaga yung may pinakamataas na risk, no? At ikaw yung nagko-contribute at naging dahilan dun sa pagdami ng kaso. Remember, except for NCR plus areas, majority of the areas in the Philippines have been in MGCQ, no? Bukas na siya yung karamihan ng mga lugar natin. Subalit, ang nakikita ng ating mga regional office sa ngayon na nagpo-contribute doon sa pagtaas ng kaso ay dalawang bagay. No? It's really the observance of the minimum public health standards. There was less adherence to face mask, face shield, and even physical distancing. And in particular for Region 6, what they were reporting to us is the presence of super spreading events such as mga birthday, social gathering, and that's also for Region 1 pala, no? Region 1 and 6, mga super spreading events such as the social gatherings and social events. Kaya ito yung sinasabi natin, no? We cannot really be complacent. I know it's really tiring. Ako, as much as possible, I want to go back to a time na hindi na ako mag-wear ng mask, hindi na ako mag-observe ng physical distancing. I want to go out with my friends. Kaya lang, napakahalaga, no? We don't want to lose what we've gained, what we've already achieved. And that's something we really need to monitor. We're asking our LGUs, our DILG to closely monitor para wala tayong mga ganito events that contribute to the spikes in our cases.
Ma'am, also a clarification with San Juan. San Juan City said, I think last week or earlier this week, na it has administered at least one dose to more than 100% of its target population. Pero bakit po nagsusurge pa rin yung cases doon? Ano po yung factors? Bakit kasali siya doon sa 8 NCR cities?
I always remind me to always show the formula. No? Pag yung formula natin or dahilan bakit tayo nagkakaroon ng case spike, ang bakuna ay isa lamang doon. No? It's one of the preventive measures. Kaya lamang meron tayong iba pang mga dahilan. Nabanggit ko yung una. You may be vaccinated, but if you don't follow the minimum public health standards, then that's already a risk for you to become infected. If you are in attendance of social gatherings, that's also one factor. And remember, ang NCR, tuloy-tuloy pa rin yung pag-detect natin ng mga variants of concern like the alpha and beta variants. And we've seen that these variants of concern, while not the major reason for the upticks, is one of the contributing factors. So, kaya napakahalaga, siguro several points, no? One, the core PDITR is very important. And then number two, it's not enough to get vaccinated with just one dose. You need to get the 2 doses, and even if you are fully vaccinated, you still have to follow the MPHS protocols.
Salamat po.
You're welcome, Kat.
So for the next question, let's have Lay.
Yes, good morning. To Doc Eva. Doc, ano po yung assumptions ng pagkakadilis ng Theta variant from the variants of interest? Since sinabi niyo po kanina yung reported cases, yung detected cases have decreased over time. Ano po yung assumptions dun sa parang properties po ng variant po na yun?
So when they delist, for example, even if the 3 that I mentioned, no, yung ating theta, yung P.3, zeta, yung P.2, tsaka yung epsilon, yung B.1.427, they were reclassified as alerts kasi all 3 variants, though they in the beginning they carry mutations with suspected and or established phenotypic impacts. So, but this reported detections of these variants, they decreased over time, suggesting a decline in their respective incidence worldwide and diminishing public health risk relative to other variants of concerns and variants of interest. I wanted to emphasize that also that when these variants will continue to be monitored, and if new evidence of impact emerges, their reclassification or their classification will be reassessed. And so they can be upgraded again to as a variant of interest, or a variant of interest can become a variant of concern. So there is a committee that looks into all these factors, Ms. Lay. Thank you for your question.
So Doc Eva, ibig sabihin po hindi siya nakitaan ng increased transmissibility and hindi rin po siya nagdulot ng mas malubhang sakit?
Well, you can say that kasi those are part of the criteria. So in the beginning, if you remember, so let's go back to P.3. When we first detected that, it was because there was a surge in the cases in Region 7. And so it was showing some signs that it might have had some increased transmissibility. But then over time, parang hindi naman siya, although we picked up a number of cases, and as of the last report, I think it was over mga 166, no, and even reported in 14 other countries. Pero parang hindi siya hindi siya naka-cause ng parang naging cause ng a number of cases increasing in a particular region, or that it has spread worldwide. So yun yung parang mga ginagamit nilang batayan for declassifying it or reclassifying it as just an alert for further monitoring.
Thank you po, Doc.
So for the next question, let's have Rafael Bosano. Rafael.
Good morning, Dr. Yat. I'm just curious, may difference po ba in handling adults with COVID from patients in the pediatric age group? Kasi po, base po dun sa COVID situationer nung weekend, parang nakakita ng 435, if I'm not mistaken, na those belonging in the pediatric age group who succumbed to the virus. So ano rin po kaya yung mga reasons why children also die of COVID?
Mamaya ibibigay ko rin kay Dr. Eva, no, as to add on. Pero ako intuitively, no, bakit tayo nagkakaroon ng mga kaso pa rin, no, among children? Well, everyone is at risk. So even though they're not outside, their household members, their caregivers would go outside and could potentially, no, bring in the virus. And that's why there are still children getting sick of COVID. Pero in terms of management, I think as a clinician, ang una kong sasabihin iba ay yung pagbabantay ng tinatawag naming warning signs. Sa bata kasi medyo iba yung presentation, iba yung binabantayan natin versus an adult. Una, mas hindi sila likely to express themselves. So kailangan talagang titingnan mo physically kung nahihirapang huminga, kung may mga chest syndrome. That's one. Pero I think I leave it to Dr. Eva to answer later kung baka merong ibang management, no? Ibang gamot ba, ibang supportive management na binibigay sa mga children. And then the second question as to why they are still dying, alam mo sila pa rin kasi yung vulnerable age group natin. No? The fact that they're the under 5, they are the ones that are most vulnerable by age in itself. And even if they are younger, there are still children with comorbidities. So nakikita natin yun. No? There will be children who may be born premature. There may be children who were born with congenital anomalies, and their inherent vulnerability based on their age group also puts them at more risk. No? Kaya yung pagbabantay natin palagi, even if it's not COVID, we always look at the extremes of age because they are the ones most at risk. But I think isang napansin natin kay COVID, no, even though they're among the most vulnerable, the percentage of children dying from COVID-19 is much less than the percentage of adults dying. And that's why the priority group are still the elderly. No? They have the 14%, 18% case fatality. Baka Dr. Eva can add on to the management and the vulnerabilities of our pediatric age group.
Yeah, I think tinawag lang ako ni Thea kasi pediatrician din ako. But according to our infectious disease mga specialists, children tend to present milder with better outcomes. And totoo yung sinabi ni Dr. Thea, those small number of children needing hospitalization with severe infection are those with comorbids like congenital heart disease, asthma, some form of immunosuppression, may history na mga diabetes or obesity. So I think although children remain susceptible, just like adults, they tend to have milder manifestations. But then again, there will be a percent of them who would need hospitalization because they have other conditions. Yun lang. Thank you.
Okay. Doc Thea, I know na nagbigay na rin ng reminder si Yusek Vergere kahapon, pero how do we see the decision to allow children to go out affect yung COVID situation natin? Kasi over the weekend nakita po natin parang nakawala lahat, no, lahat nagpuntahan sa Manila Bay. So should parents take it upon themselves talaga to really exercise discipline?
I think I call it a managed risk. No? Everything about COVID is managing risks. Kasi kung gusto natin na 100 protected tayo, alam mo, we will really all just stay at home. We will close off all borders. No? Pero ngayon, we're trying to live with this virus. We want to race against it, but we want to be able to return to new and better normal. So ano ba yung mga pagpapaalala na ibinibigay natin? No? Of course, we now see that the risk of allowing children to go outside is much less, no? And we're balancing it dun din sa mental needs ng ating mga bata. Sabi nga, o yan ulit kay Dr. Eva, napakahalaga ng this age group. They get exposed, no? They get exposed to things outside. Hindi sila yung nakukulong sa bahay. At isa yun sa major considerations natin. Pero tulad nga ng nabanggit ko kanina, the contribution of children to the total case count is so low. The contribution of children to the total death counts is also so low. And because the case fatality rates, the proportion of children dying is very low. It's actually less than 1%, no? Of course, we don't want anyone dying, but the risk is very low. So, ganun pa man, yung ating pagpapaalala sa ating mga magulang, sa ating mga caregiver ay yung sa outdoor area lamang. Huwag po muna sana sa mga indoor areas because these enclosed spaces are where the highest risk for transmission and infection happens. Boring man yan, sa parke po muna tayo. Bisitahin muna natin nga ang Manila Bay. Bisitahin natin ang Luneta Park. Kasi at least ventilation is better, no, if it's outside. And of course, the second is mag-mask pa rin po tayo. Mag-face shield pa rin po tayo at mag-physical distancing. Mahalagang aspeto po ang pagmamask. Kaya ho natin nilimita ang edad sa 5 years old. Kasi nakikita natin, yan yung edad, no, na comfortably, they can already wear mask. Hindi na sila kailangan ng super, very close supervision just to ensure na sila ay tama ang pag-wear ng mask.
Thank you,
Thank you,
Rafa. Question, let's have Greg.
Hi, good morning po. To Dr. Eva, Doc, you've mentioned earlier na even though Theta has been reclassified to just alerts for further monitoring, local authorities may still consider such as variants of local interest. Dito po sa Pilipinas, how are we treating Theta, and does the reclassification mean na i-exclude na po siya sa bulletins natin or sa nire-record ng Genome Center?
No, thank you for your question, Mr. Gregorio. Definitely not. It will not be excluded from our surveillance. Our surveillance po is, although we're reporting all the variants of concern, the variants of interest that we are able to sequence in our genomic surveillance. So definitely we will not take out Theta or P.3. In fact, right now, hindi na yata Theta tawag sa kanya. Because it has been reclassified. So parang balik tayo sa P.3, no? So that's for your second question. Your first question was about can you remind me?
How are we treating po the P.3?
Right. In terms of declaring it as a variant of local interest. For the moment, we have not had the opportunity to meet yet and to declare it from the national perspective as a variant of local interest. I think what this is something that we need to think about very well and to closely monitor before we make such forms of declaration. Maybe Dr. Thea, you'd like to add something to that?
Thank you, Doc Eva. So dagdagan ko lang na despite the reclassification of the P.3 or the Theta to not a variant of interest, we still monitor the Theta variant. Ganun din naman tayo, ang goal ng biosurveillance natin is not just to detect or monitor variants of interest or variant of concern, but all variants. And ang ating UPPGC ay binabantayan even the individual mutation. So I leave it to Doc Cynthia one time to discuss. Kasi anything can happen. No? Sabi nga ni Dr. Eva, it's a continually evolving story. And hindi tayo magle-let down ng guards natin. Sa ngayon, meron tayong nakikita ulit ng mga dagdag na P.3. Pero ang tinitingnan natin ay kakalat pa ba siya? Mabilis ba yung magiging spread niya? O di kaya magkakaroon ba tayo ng future data na nagpapakita na transmissible siya or may epekto ba sa ating severity ng pagkakasakit o di kaya sa ating vaccination?
Alright po. Ma'am, doctor's last na lang po. This might be sound paulit-ulit, pero how would you like to respond to those individuals who up until now think na all of these transmission could have been prevented if we have implemented a travel ban immediately, even before I mean after we have detected the first two cases of SARS-CoV-2 in the country, and pati na rin noong nakapag-record tayo ng UK variant case dito, if I remember it right, early this year or late last year po.
Sige, I'll answer first. No? What I've mentioned earlier, the travel restrictions or travel bans are there to buy us time. We did institute measures, no, para tayo ay magsarado ng bansa natin nung una tayo nagkaroon ng balita na may mga kaso, no, ng SARS-CoV sa labas ng bansa. At yun ang dahilan, di ba, may 3 tayong nahanap at meron tayong higit sa 1 buwan na hindi tayo nakakita ng mga bagong kaso. No? Pero yun din ang natuto din tayo doon na yung door 1 ginawa natin, pero napakahalaga din po ng door 2. Para kung bubuksan man natin ng bansa, yung risk natin, no, na magkaroon ng papasok na kaso at ngayon mga kaso ng BOC is much less. We also instituted that same strategy when we first heard of the B117 or the Alpha variant reported in UK. That's why on top of imposing travel bans, we also had our biosurveillance program. Pero nakita din natin, no, na the travel restrictions are there to buy time. Nakapasok siya. At dahil nakapasok siya, alam natin, kailangan pa natin kung ano man ang ginagawa natin border control, palakasin pa natin. And I think I'd like to believe na because of the detections or non-detections of local cases of the Gamma and the Delta, will support the stronger border control. And yun, additional na oras talaga para sa atin na palakasin pa, no, yung ating mga sistema at kapasidad local. Doc Eva, baka po may gusto po kayong idagdag.
So thank you, Greg, for the question. So before we end this
Thank you.
I think we have some reminders from our OIC, from the OIC, the Communications Management Unit. I would like to call Laura Saison. Laura.
Thank you. I think may question si Carlin. Carlin, you may ask your question before we give our final reminders.
Okay po. Good morning po. Very quick lang po. Pwede po siguro either kay Ma'am Thea or kay Miss Laura. Ma'am, tatanong ko lang sana, sorry, not related dun sa topic. Ma'am, ano po yung mga current mga nakalagay dapat na i-implement under Universal Healthcare Law na napabilis po yung implementation ngayong pandemic po? Thank you.
I'll let Laura expound further. Pero ako, no, as from EPI and surveillance, isa sa na-fast track natin in terms of UHC is improving our surveillance systems. No? Prior to the pandemic, we had a lot of non-functional epidemiology and surveillance units. Our information and surveillance systems were very dependent on paper-based reporting systems. Sa ngayon, we're digitizing our collection of data. We also saw an increase in the number of functional SUs. At the same time, I think hindi man 100% na dekalidad ang ating datos. The completeness, the timeliness of our data has really improved, no, from the start of the pandemic up to this time. And that's why, and even our processes, that's why we're able to actually provide the media, our public, our stakeholders data on a daily basis, which I think kung before this pandemic, mahihirapan talaga kaming gawin because of more traditional ways of collecting and processing data. Laura, baka you'd like.
Sige, Carolyn, I'll try to answer that, but maybe we'll schedule another kapihan regarding this. No. So first and foremost, if you look at the Universal Healthcare Law Declaration of Principles, it talks about whole of government, whole of system, and whole of society approach. No, sa pandemya and the way we battle out this COVID-19, hindi na lang yan naging catchphrase. No, it was embodied in the IATF, and you see how LGUs are also aligned with how we are ensuring that we're battling out this pandemic. So this is a system that we can tap anytime, no, when it comes to ensuring that more of the massive reforms in the universal healthcare law are implemented. So di na lang yan catchphrase. Pangalawa, when you talk about health system delivery being reimagined, no, for the longest time we're trying to talk about how do we address fragmentation and how do we ensure that primary to tertiary level of care would be provided in an integrated manner. So sa batas ng Universal Healthcare Law, sinabi niya na magkaroon tayo ng province or citywide health system. But we talk about what would be the incentive of the province to integrate with the barangays, diba? In this pandemic, it provided the barangays, the municipalities, and the cities in the province to integrate as a system. Bakit? Kasi na-realize ni probinsya na kahit nasa kanya yung pinakamagandang ospital, pinaka-equipped na facility, kailangan niya yung barangay health emergency response teams, yung barangay healthcare workers to monitor, to do contact tracing, to ensure that the basic services are provided in each and every household. At the same time, your barangays, your municipalities and cities saw the need to integrate to the province system kasi kailangan mo ng RT-PCR, ng testing, ng kailangan ng referral system for those na kakailanganin ng hospitalization. So now the challenge is how do we provide additional incentives and ensure na talagang ma-institutionalize natin tong referral system na to. I think yung pangatlo would be to say na naging mainstream yung usapan ng health, no? At hindi na lang DOH, hindi na lang PhilHealth yung pinag-uusapan natin. But clearly, na-delineate yung role ni PhilHealth as a payer, yung role ni LGU sa pagpapatakbo ng kanyang local government unit. So I think those are the three things, no? Hindi na lang catchphrase when we talk about whole of system, whole of government, whole of society approach. When we talk about reimagining how healthcare delivery is being provided in an integrated manner, nakita natin yon with the scaffolding of our COVID-19 referral system. And lastly, we talk about the problems in the health sector as a country na, as one government, and not just DOH and PhilHealth. So yun yung mga na-fast track. Now, I give the floor to Dr. Eva for her final reminders before we close this session. Thank you.
Si Dr. Thea. Anyway, my final reminder that are in the key messages that I gave earlier. That number one, that the P.3 has been reclassified as an alert for further monitoring, but it will be continued. Its assessment will continue. Second is that there are no local cases of Delta variants detected so far. We shall continue our vigilant genomic surveillance. We still need to continue to practice minimum public health standards. And number four, though the vaccines work, and even if they show in studies that they have different efficacies, they remain effective and will help curb this pandemic. Yun lang po. Maraming salamat.
Thank you, Doc Eva. Doc Thea, do you have your closing message to our viewers rin po? Okay, so Thea, closing message po.
Sorry. So, salamat. Again, it's always a pleasure to have this kapihan with our media partners and now we have our students here. Always an opportunity to clarify things and also to more informally discuss kung ano yung situation natin. Siguro yung huling paalala na lang ay yung pangangailangan na we act as one. No? Kanina sabi nga ni Laura, this is not a DOH issue, this is not a health issue. It's us and all of us have a bag, all of us have accountability from number one, pag-i-ensure that the borders are strong, and then tayo din dito, we ensure that we can be resistant, no? We can prevent infection or infecting others by our MPHS protocols. And of course, no, yung nasa front line po talaga ng ating laban against COVID, our LGUs and our health workers, no, to further strengthen our PDITR and health service delivery. So yun lamang po. Thank you very much.
Thank you, Dr. Thank you everyone who joined us in our kapihan session today. That's all the time we have, and see you po sa next events po natin.